I'm going to go through the translations in the cervical spine, and then I'm going to demonstrate some ways to palpate, mobilize, and treat the uncovertebral joints. There's been some questions about that. So let's go through real quick. What I can do is take my fingertips here, I can come onto the transverse process, and I can do my lateral translation. Getting a sense of feel, I'll compare right to left, working my way down. Typically what we do is when you find a segment that's tight, say I find here this right segment's tight, I'm going to go in further and check it out. So I'm tight with right to left translation. Then what I can do is I can come in here and I can check the ability of the right side to extend by just lifting up gently with my fingers on the superior articular pillar and gliding it down and checking the mobility. Again, I will check over here for flexion. So I'll come right over here on the left hand side and again flex the head up a little bit, and then I can just kind of take this joint into flexion. Test the end feel there. Now if it is restricted in both flexion and extension, then I'm going to make the assumption that this is an uncovertebral joint, since the facet joints won't be tight in both flexion and extension. Test the uncovertebral joint, and I'm going to check the right-sided imp, which is inferior, medial, posterior. I'll come onto the transverse process with the pad of my finger. I'll put it on the anterior portion, and I'll stabilize on the left on the inferior segment just below, and I'm going to glide imp inferior, medial, and posterior. I can also check the sow glide on the right-hand side by pushing down on the vertebrae beneath the segment I'm interested in, stabilizing the superior on the right, and feeling the relative sow glide of, we'll call this segment C4 on C5, of C4 on C5 on the left. Now there are ways to treat this. We have for manipulation. Everyone is taught in the first course the lateral translation, which will just load this and treat the straight translation. They also went into the uncovertebral manipulations. First technique is, if I want to do the imp glide on the right, I'm going to stabilize C5 on the left, and I'm going to manipulate the imp on C4 on the right, going inferior, medial, and posterior. Another way there too is they talk about anterior and posterior. That doesn't take care of it. I can check this joint by just taking the pad and gliding this joint anterior and posterior. Just giving it a little wiggle, and I'm looking for the worst end feel. Let's say here I find that anterior glide is better than the posterior. I can then come on that right side and I can manipulate the posterior glide. Another nice technique, if you're feeling a little uncomfortable with starting these techniques or having a hard time feeling them in clinic, here's a nice technique to get used to working through your neck. You can work the imp glides and to some degree the flexion and extension glides by, I'll come onto the lateral side here. If I want to do the imp glide on the right, I can position my pad of my finger on the anterior portion of the transverse process by putting my hand on the lateral portion and rounding it anteriorly. I'm going to come onto the same vertebrae here. So I'm on C4, I'm on the anterior portion of the transverse process on C4. Now the pad of my finger here is on the posterior process, or the posterior portion of the transverse process of C4. And what I'm doing is a relative simultaneous imp and sow. It's going to be an imp on my right hand, a sow on my left. And again, I can easily reverse my pad position and do it the same way. I find early on, if you're having a hard time feeling these motions in the cervical spine, especially with the translations, go to the same segment, again, pad on the anterior portion, pad proximal index finger on the posterior portion of the transverse process, same level, and do the relative imp and sow glide, and use this as your mobilization in clinic. I find that I can feel this imp and sow motion a little bit better, and it helps to clear up the translations. So if I'm unsure with the translations, come in here and see. Now with this motion, you may also have a restricted facet. Flexion restriction or extension restriction will show up here. But if you're really struggling with the gross assessment of the neck, practice going through, do the translations, come back, and do the relative same level imps and sows. If you find that it's positive on both, then check the facet joints first, then uncovertebrals, and then you can just kind of mob. So I can use this as a mobilization with the imps and sows by coming onto the anterior transverse process here on the right with the pad of my finger. Again, it's a way I can manipulate this right side downward into extension, or treat the relative imp glide on the right or the sow glide on the left. So try playing with this mobilization for imps and sows, get a feel for it moving up and down the neck. I think if you do the simultaneous same level imp and sow, it'll give you a better feel for the joint. Thanks. Good. Okay, I'm going to try and go over the imp and sow glides with the skeleton. Now, this model certainly isn't ideal, but hopefully it'll help give you the picture. The uncovertebral joints are located right here where the tip of my finger is kind of coming in here. And if I'm going to wiggle this vertebrae and think of this motion here as a bowl, top bowl moving within the bottom bowl. And that's your imp and sow glide relative. So what we're doing with the imp glide, if I'm going to do the imp glide on the right, I'm coming onto the anterior portion of the transverse process again, and I'm gliding it relatively down into the imp. And it gives a little bit of motion there, where you can see the imp. And then we can create a relative sow glide over here by pulling up. So for the mobilization technique that I talked about, where we'll do the same level, my pad here is going to come right on the anterior portion of the transverse process, and the pad of my finger here is going to come on the posterior portion of the transverse process. And what I'm going to do is I'm going to rock this hand up into the sow, and this hand down into the imp. And sometimes this gives us a good feel of this side bending motion in the uncovertebral joints, as well as flexion of the left facet and extension of the right facet of the joint that I'm on. And again, I can quickly reverse it. This is handy if you're still having a hard time getting a feel for the neck. You can't really feel these glides very well or identify them consistently. Work on identifying the translations first, and then practice the imp and sow glides. It's actually an excellent treatment technique on a delicate neck or an arthritic neck, is just to work these mobilizations and at the same time get a feel for how the necks move around. So it's a good way where, you know, assessment and treatment kind of come in together. Again, demonstrating the uncovertebral bowl, I can grab it with my fingers here and show you, is that motion there. That's what we're looking for. So with the translations, I'm going to test this with my fingers. We're looking for this motion. And again, that would be extension of the facet, of the right facet, flexion of the left. Or we're looking at the imp glide on the right, or the sow glide relative on the left. Manipulation with stabilization is if I want to be able to manipulate the imp glide on the right. I'm going to stabilize inferiorly on the left, come onto the transverse process, and again, imp glide down and in while providing stabilization here. Some even suggest a counterforce. When I hear counterforce, I think this would be 80% of my force, and this matches 20%. So just enough force to keep the side bending motion from occurring. So just a little bit of a give there. So I think of a 20% in my mind and 80% here.